Welcome back to Living In with Amy. We are really excited today to have a special guest with us. We have Dr. Doug Spots, the Vice President and Chief Health Officer of Meritus Health. Hi, Dr. Spots.
Hi, everyone. It's great to be with you.
Yes, and as you can see, we are social distancing. So we'll start today by talking about the importance of social distancing.
During the midst of this COVID crisis, I would say the biggest thing that we can do to support the community response to fighting this virus is to maintain our social distancing. I know it's uncomfortable and it's tough to get used to our new normal, or at least the normal for now, but very important to do this.
It is. And so what's that recommended distance?
Well, it's about 6 feet at least. And so when you do have to go out to the grocery store, you'll see lines in some stores now to help remind us of what that looks like, because it's more than what it feels comfortable to us as a social people. But that's important. We've moved all of our committee meetings and so forth at the hospital to WebEx technology so that we're not in a room together. And it's been working pretty well. It's not the same as face-to-face, but we're doing well.
Good, good. And so, as we know, social distancing is super important to stop the spread of COVID-19 as well as other secondary infections as well.
Correct.
But what are some other things that we can do besides just social distancing?
So I would say also really good hand hygiene. And really good hand hygiene is washing your hands in warm soapy water when at all possible. And not just washing them in warm soapy water like we normally do, but warm soapy water front and back, and also for a good period of at least 20 seconds. That's about the time it takes to sing happy birthday twice. Some people have said you can recite the Lord's Prayer during that time or another religious devotion, but 20 seconds is longer than most of us wash our hands. So that's number one, the most important. And then the other, if you don't have warm soapy water available, of course, would be hand sanitizer of any of the various types out there.
Great, great. So we've been pushing at least 60% alcohol in those hand sanitizers to make sure that they're effective, but that you're using enough of it.
Yes.
You know, people are trying to preserve, but really to make it effective, you really need to use a good amount of that.
You need to feel it on your hands, all over your hands and between your fingers, back and forth.
Getting your thumbs as well.
Thumbs.
Yes.
A lot of germs live on your thumbs.
Yes. And so, you know, technology today, you know, everybody's using their cell phone, and disinfecting surfaces are so important.
Right. So there you would have Clorox wipes or Clorox solution, and then there are electronic friendly wipes out there as well. But yeah, trying to do that as much as you can to wipe down the surfaces is really good. Doorknobs, handles, just think through the things that you touch every day. And then just really trying to practice your hand hygiene of not touching your face, particularly rubbing your nose or your eyes. That's important. And if you don't think that you touch your face a lot, feel your hands, lock them and think about many times you do that. Even adjusting my glasses, I'm trying to use my pen or something else right now.
Right. Moving your hair, all of those pieces.
I don't have that problem.
So I think it's really important that when you're using disinfectants that you're following the instructions on the back of the containers. But also, if you're going to make your own solution, a bleach solution of 5-to-1, and that's from the CDC, the Centers of Disease Control, you can mix that up for 24 hours in a spray bottle and use that solution to disinfect. So really important. But on another episode, I talked about how living in is like a step back in time. And Dr. Spots, you were a family doctor.
Correct.
And you have your bag here with you today. Talk to us a little bit about how it used to be, and now we're changing.
So I've been really privileged to practice for now 25 years and still have a little bit of practice involvement with the residency program. I came to the Commission on Aging and gave a great talk and brought my black bag just to show that family doctors and doctors still have black bags. So this was a bag that my wife got me when I graduated medical school. And you can see it's beat up a little bit, but it's been on many house visits with me. And so in this black bag, I have the traditional tools that maybe all of us are used to seeing, like the stethoscope, and an otoscope is in this case, and a blood pressure cuff is in here as well. So we're all very familiar with those types of tools. But then I also put my cell phone in there. And I even have a smaller laptop that can fit in this bag. And just to point out really the emphasis of technology and the importance of using technology that is right at our fingertips today. So resources that we can look up, like the bleach solution you talked about, calling up the CDC resources on the browser of your phone or your smart device. It's also important to look at, I grew up on a farm, so I'll use a farm analogy of separating the wheat from the chaff, of really finding what is truthful information and scientifically sound information in these times. So, verifying the source. The CDC is a really good place to go. So is Johns Hopkins. They have a really excellent resource that sort of gives live information about and updated regular information about COVID. And then also the Maryland Department of Health, which you can go to by health.maryland.gov.
Yes.
So those are all great resources that I would recommend.
Absolutely. Credible resources. Of course, Meritus Health has their website as well, and the local Washington County Health Department. Check out those websites or getting up-to-date community information.
Right.
But talk to us a little bit about technology and telehealth. That's something new Meritus Health is offering. We're really excited about that.
Right. So we have, in short order, done a number of initiatives around telehealth and telemedicine. So that would include a community resource staffed by our providers, which you can contact if you can't reach your own provider, your own medical provider. And also if you don't have a medical provider. And so that's a resource that if you have a question, you're not sure, what should I do? If you have symptoms, we're coming into allergy season, the end of flu season. So not every sniffle means that it could be the beginning of the COVID virus.
Right.
And so just having that trusted guidance, I would say to encourage you to think of a non-traditional visit. So I may not be able to come out with my black bag and do a home visit, but I could use a televisit where, with a really simple application downloaded for free on your phone, you can connect to a provider. And we have a COVID hotline for emergency telephone calls and a non-urgent question line through an email address. And that will be run with this episode across the screen. And so, I would encourage you, if you're not sure, to use the telephone line for a more emergent type situation or urgent, and the email for sort of non-urgent questions, but they can all point you to the resources for the telehealth visits. We're doing them in our own Meritus Medical Group practices. And then sort of our third prong approach was Meritus made available to the community doctors who didn't already have a telehealth solution with their electronic health record. They made available a WebEx tool that those practices can push out to their own patients and have that ability to be able to see you. So it's sort of a two-way visit. So it doesn't, it's not the same as being with you in the exam room or seeing you face-to-face at a house visit. But it is a way beyond the phone call to actually touch base with you and sort of give you reassurance during these times.
So really excited that this opportunity for free telehealth is a way that we can connect together as a community and support one another in the comforts of our own home. So Dr. Spots, tell me a little bit about ways in which Meritus Health has really stepped up and become innovative besides just this telehealth option.
Well, we were really out front about doing the community screening, drive-through, and walk-through lines. Now, that has changed because we still are facing a shortage of testing reagents, not just at Meritus, but in Maryland and in our country. So, we'll talk maybe a little bit later about some of the different news reports out there, and we're all really trying to grab a hold of hope right now that we can have an instant test and that we would all qualify for testing. But I have to say that not everyone qualifies for testing right now. So over 65, and if symptomatic or at any age, if you actually have high risk for this disease. So if you have an immune compromise in any way, you're undergoing chemotherapy for cancer treatment, you have an immune disease that your system just can't fight things off quite as well as other people. So there are very strict guidelines about that. So just by coming to the screening line doesn't mean you're automatically going to get a test. And I have to emphasize that because, as you can imagine, we have people driving up thinking that they're going to automatically get a test. And they have to meet very strict criteria that are set by the CDC and by the State Department of Health. So it's not a Meritus decision, but we are there for the community. So we have that out at our Meritus Medical Plaza North, outside of our urgent care. And we've actually stood up a walk-through line at Walnut Street Clinic downtown. and at the old Surrey building. Now, the Surrey building clinic is closing because we just did not have the volume coming through there at this time, and so that's being transitioned to Walnut Street, but we have the ability to stand it up if we had to, if it increased again. So people have been listening, they've been staying home, they've been only, coming out if they're feeling more symptoms or if they've been advised by a healthcare professional to come out. And again, we have these resources to connect. I don't want technology to be a barrier or people to be sort of afraid of the technology or say, well, I don't have a smartphone, I have a flip phone, or that type of thing. Talk to somebody in your family, other resources in the community, but we can still do a visit by phone if we need to.
Right. So if you are caring for someone or you yourself become symptomatic, it's really important that you touch base with a healthcare provider via phone first, and they'll give you that direction whether or not you should be going to a drive-through to be tested, or find other direction to support you.
Absolutely. I can't emphasize enough. Don't just walk into the office, especially if you're having symptoms, fever, cough of any sort. It doesn't mean, again, that it's COVID, but touch base with your team, your healthcare provider team first, and use their advice to make that sound judgment.
Well, we are so very thankful to have the talent like Dr. Spots in our community and the partnership that the Commission on Aging continues to have with Meritus. We are very thankful for that. And we encourage you to stay healthy, stay tuned in to local officials and credible websites that we've talked about today, and certainly reach out to the Commission on Aging at 301-790-0275 with any questions that you may have. You can certainly comment down below and we will get back to you in the near future. And again, thank you, Dr. Spots, for your talent and your time, for being here today. And while you are home, please stay tuned for more. Visit our websites, visit our Facebook page, and just enjoy living in.